This interview is brought to you by NTT Data. Federal health agencies work tirelessly to protect us from health and safety threats that arise at home and abroad, so we work tirelessly to bring them reliable, cutting-edge IT to improve productivity, leverage data, and save lives. As a top 10 IT service provider, NTT Data can help your agency put modern IT solutions into motion with our proven end-to-end practices, platforms, and services. Together, we can streamline government operations, implement AI successfully and responsibly, and improve public trust. Visit nttdata.com. Hello, everyone. Welcome to the continuation of our 2025 HIMSS conference coverage. I'm Sarah Seibert, the managing editor at GovCIO Media and Research, and today I'm joined by Shane McNamee, the senior advisor to the CMO for Health Solution Architecture at the Veterans Health Administration, and Johnathan Nebeker, executive director for Clinical Informatics at the Department of Veterans Affairs. Thank you both for joining me today.
It's great to be here.
Yeah, so to kick things off, there's been a lot of talk about interoperability, a lot of talk about AI. So how is VHA improving data integrity and interoperability as you start to leverage artificial intelligence?
So we're really pleased with our progress, especially in the last year on this. It takes a community, so it's not just VA, but VA and all of our partners. And so we like to think about interoperability in two parts. One is like a plumbing example. So you have the pipes that allow us to exchange data.
Right.
And there's a lot of attention traditionally on that. TEFCA, QHIMSS, HIEs are a lot about the pipes. But then we're putting more of an emphasis on the data or the water that's flowing through those pipes, because for a lot of it's just non-potable water. Like
right.
We can't use the data because it's, you got internal codes from the EHR going into, the documents that we exchange. And so you can't automatically pull out the data you want to do quality assurance or decision support.
Right.
And so on that topic, we've been working with a partnership led by Levitt Partners. Ryan Howells has been amazing to work with, and also supported by other people in the field. And we've been able to get somebody from industry to put their product that tests for data quality into open source, create a community practice around that. So that really kind of for the first time, we can have an open and transparent and community-defined way of checking the individual elements that go into a message. And so, for example, if you wanted to say like, hey, what's my sodium in my blood, right? And so the sodium is, so there's like the number of the concept of this to some terminology. Let's say it's like 531. Does that match up with sodium, right? Or is it 531 is really about blood pressure? And then it's like, are the units right? Is it, whatever the units are in the blood? I'm just a doctor. I don't know what those are. And so,
yeah.
That's right. So then finally we can get a scorecard to grade the data that's coming through. And we hope that insurance companies will say, look, we really have a stake in decreasing costs by understanding what's going on with the patient, providing decision support. The VA also has a stake in making sure that veterans have the same quality of care no matter where they are. We get a global picture of them. And, especially in Congress, the chairman of the House Veterans Affairs Committee is like, community care is VA care. We're responsible for the veteran no matter where they are. And so this is how data quality can really help us do that with better quality surveillance and decision support.
Right, that makes sense. And then
jumping in on that a little bit, it's important to note that we've built an incredible interoperability infrastructure in the VA to this point, but it's not enough.
Right.
We're not far enough yet. We have 100,000 partners that we exchange data with. We cover 90% of all the facilities in the United States. There are 350 million documents monthly that are passed through, but it's not enough, as I noted, because the real goal here is seamless veteran care, care without boundaries. And when we have uneven or low data quality, it takes our clinicians and our population health teams and our care managers to read through all of the different documents, extract all the information in their head, and then find a way to use it. What Johnathan just talked about with the PICI framework and improving data quality, when we get to that level of potable water or potable data, we can actually start to drive that into AI agents and other AI solutions that help us rapidly improve the efficiency for our clinical providers. One of our main end goals is how do we get when it comes to interoperability data, more data isn't always better.
Right.
If you're the person who's on the other side of it, how do we get the quality to the level that we can start to take advantage of AI agents and other next generation capabilities that allow clinicians to start being clinicians again,
Right.
and not simply tied to the computers all day long.
Right. So as you're looking at some of those opportunities for data to be integrated into AI, how could AI personalize healthcare?
It's a couple of ways. It can make precision medicine more precise. We've had a big thing over the last 10 years in industry of using genetics to treat cancers and other ways. But there's still a major limitation in there in terms of a human's ability to understand what's available, how do you match. And so truly just taking precision and making it more precise. A couple other ways is one of the ones, and Jonathan's a huge proponent for this, is hearing the veteran's voice through their goals, right? Healthcare generally is driven by the healthcare team's goals or what public health thinks is best. But we as, veteran committed and mission focused, we want to know what their goals are and move them towards it. I'm a rehabilitation doctor by trade. It's much more important to me to make sure that our veteran can, get to his daughter's wedding and dance with her than it is necessarily that he's meeting all of the outcome metrics that are necessary. So how do we bring both of those together using AI in different ways to allow the veteran voice to come through? And I think the third one, which is a major one we're working on right now, is how do we decrease clinical burden, right? How do we, we're at about 60 to 80% of the time now that clinicians are in front of the computer acting as the AI agent or the automation agent between all of these things. How do we start to take technologies like the ambient scribe technologies that we're seeing on the floor here today? We did a tech sprint last year, and we're working on now bringing forth ambient scribe capabilities that listen in on the doctor and patient interview, transcribe it, bring it forward, allow the orders and things to come off of that. And we see, as we're going to be developing this through our clinical decision support platform that Johnathan has been leading, a great way to start to improve efficiency and decrease provider burden.
Right. Yeah, those are exciting use cases. And what are some of the use cases you're seeing on the interoperability front? Are there certain projects you have in the works or have seen successes?
So we kicked off something called, in the last administration, called the Veteran Interoperability Pledge.
Mm-hmm.
And so one of the luminaries from I like to joke around with him, came to the undersecretary and said, look, we'd like you to help, me on these projects, can you do that? And the undersecretary said, well, how about we set up our own Veteran Interoperability Pledge, and you can help us serve veterans. And so, of course, he was all in on this. And so we signed up. We had a meeting in D.C. with 13, very high quality, mostly large, some medium-sized healthcare systems, mm-hmm. CIOs, and mostly CIOs, and said, what is it that we need to collaborate on to provide care across the community? And so the first was the Veteran Confirmation Pledge. So this is an authoritative pledge that gives, legal status on whether someone's a veteran or not. We call it the Dick's Sporting Good API because Dick's uses it to provide veteran discounts to their customers, right? And so it's not only for healthcare, but right now veterans are underreporting themselves by 20%. So we found additional 20% more veterans at healthcare systems who, when they're asked to check in, hey, are you a veteran? They may not say anything, or they may never get asked a question, mm-hmm. right?
Right.
And so now suddenly we can identify who the veterans are. And so what they do is they say, okay, some healthcare systems say we're not going to send these guys to collections for medical debt.
Right.
So that's, a big benefit for veterans. Another is they'll say, okay, if this person is coming in for suicide crisis, then instead of discharging them from the emergency room to the street because they don't have health insurance, even though they're not enrolled in VA benefits, there's new legislation that entitles them to VA benefits. So they can get, all the mental health treatment that they need for 3 months that the VA will pay for. So this is another, unless we know they're a veteran, we can't provide that. Mm-hmm. And then finally, for toxic exposures, there's new coverage for the PACT Act, mm-hmm. for toxic exposures Compact Act for suicidality, where the healthcare systems now are triggering a message to both the providers and the social workers to say, hey, it looks like you have a condition that could be caused by a toxic exposure. And they have a little bit of a conversation, and then they can talk to the veteran about whether they want to have care for free, 100% free in the VA, for their cancer or heart disease or whatever, or whether they, want to say with their other regular insurance for the private sector. Mm-hmm. And so it's amazing that these healthcare companies are really looking, uniformly, it's about putting the veteran first. They're not like saying, how do we game the system? How do we, get money from VA? They're really truly focused on the veteran and the value to the veteran. Super exciting.
That is really exciting and leads perfectly into my next question about the PACT Act. So what are some of the other ways these technologies are improving benefits delivery and helping process some of those claims? Because I know they've been at all time high. Yeah.
So the American Hospital Association came to us and said, hey, actually they came to the undersecretary and said, we need help figuring this out. How do we connect veterans to the benefits they already have? And let me just say, it's an ongoing conversation. Yeah. We're trying, there's all sorts of opportunities to automate, benefits adjudication. And so I think we just need to get on the same page within the VA to figure out how do we combat fraud? How do we promote veteran benefits? And really, I think we all want to err on the side of the veteran. But just yesterday, somebody came up to me just kind of out of the blue and said, from a standards-based insurance broker, saying, hey, we really want to help you with the PACT Act because it's taking too long to get veterans connected to their care. Mm-hmm. And so these are it's a team sport. We just can't sit back and say, okay, you guys come to us or dictate to the community, you have to do this. Mm-hmm. We have to work together. And what's going to work for veterans is going to work for all Americans in most cases, right? Mm-hmm. So it helps advance. It helps, that tide that raises all boats.
Right. That makes sense. And as I mentioned at the top of the interview, we're at HIMSS in Las Vegas. What are some of the game-changing technologies you all see on the horizon, or what are you most excited for?
So I'm going to go back to one of the problems that we're trying to solve, which is 60 to 80% of clinical and population health teams is spent working for the computers and connecting all the programs together, connecting all the data together. And we need massive efficiency gains associated with healthcare delivery. And that leads us to agentic AI, right? To be able to use either single AI agents that are bespoke with their LLMs for specific problems, or what we're seeing here now, and I don't know if there's a term for it yet, but agentic orchestration, where you have a central AI agent that has, 30 or 50 different agents that it can call in a microservices way to answer specific questions. Those kind of things.
Or trigger tasks.
Or trigger tasks. Yeah. There we go. Those kind of technologies at the elbow of the clinical and population health teams and the care managers and the veterans, if they're brought out safely, and that's a big thing here, is we have to make sure that they're safe before we bring them in, right? You don't just build a new elevator without brakes on them. Right?
Yeah.
You need to make sure they're safe coming in. But the application of those, I think, personally, is going to start to maybe bring us into this digital age of healthcare where all of this technology and all these things that we're doing is actually improving efficiency and quality, rather than mostly just increasing burden here today.
Right.
So again, kind of summarize a little bit what we've been talking about, getting the voice of the patient, right? The voice of the veteran. What's most important to them? How can we meet their goals? So moving some of these ambient dictations from kind of the dry, in the computer's voice, very eloquent, but in the computer's voice, to additionally surface the patient's voice in that ambient scribe kind of conversation. What are the goals of the patient? Second, both is, orchestrating care, both with robotic process automation, which is kind of algorithmic, deterministic, right? And then, but now we can bring in the agents to help, cover some of those gaps so the algorithms won't process. Then you've got the interoperability, so we know what we're talking about. We're not having to fill the gaps. And so, you don't really want artificial intelligence to fill a lot of these data gaps because, especially when it's just not that hard to pay attention to get the data into the right place. And it's hard because every institution has to do it right now. We don't have a good ways of handling that. But so I think what we'll see here is an acceleration no matter where the patient is, including for veterans, no matter where they prefer to get the care, how they, would they rather interact with a computer? Would they rather interact with a person? We can then orchestrate their care to get them the most high reliability care that meets their needs as quickly as possible and at the lowest cost especially to the patient, but also to the healthcare systems.
Right. That's really exciting, and I can't wait to see how this develops and follow along. Before I was in my current position, I was the VA reporter. So
okay.
Yes. It's very exciting, and it's cool to see how much it's developed over the years. So thank you again for joining me today, and I hope you enjoy the rest of your conference.